So my name's Kathryn Waite, and I am currently curate at St Andrew's Church in Chesterton, which is in North Cambridge.
Thank you, Kathryn, and thank you very much for coming and agreeing to talk on this. What should we call this? This series. Yeah. But we know each other from your former life, so reveal what that was.
So I think we first met years ago on a neurology ward when you were registrar and I was a senior house officer. So prior to ordination, I was a hospital doctor, just like yourself. And I ended up being an oncologist, working in Addenbrooke's and Kings Lynn as a consultant for over a dozen years.
And just to be clear to everyone, so an oncologist does what?
So an oncologist is somebody who treats people who've got cancers. And I treated patients mainly with lung cancer, but with some other cancers as well. And I used chemotherapy and radiotherapy, so I used both things.
Yeah. So it would have been part of your everyday medical life to talk to people about whether they could be cured or not cured, and whether they could have treatments that would extend their life or not, whether treatments were palliative or not. That would have been pretty much a daily thing, I guess.
Yeah, that was, I was going to say, it wasn't often that I met a patient and we didn't have one aspect, discussing at least one aspect of those things almost in every time I met people. So, and sadly with lung cancer, the survival rates are really poor. So the majority of patients that came through my doors to see me had a really poor prognosis. So they were conversations that we sadly were having a lot of the time.
And in that context, as a medical professional dealing with people with lung cancer, did you ever talk about healing, that word, or that concept? Was that a useful word or a useful concept?
Probably not. I don't know, not sure whether I actually used the word healing. I think I often use the word treating. I think I often use the word palliating or making you feel better, helping your symptoms. I don't think I actually often use the word healing.
Yeah.
And cure, and often we avoided the word cure because even when you were aiming to cure somebody, because that was the intent of your treatment, that there was a chance that you might cure somebody, we know that often the treatment wasn't, it was never a guarantee. So cure was a word I very rarely used, although it's perhaps a word more people use when they think about treatment.
Yeah. And yet, so if we move into the Christian world, if we can call it that, and Christian healing is talked about a lot.
Absolutely.
So do you find is that easy, that switch? Or is there part of you, I have to say that there is with me, that sort of medical side that is just a bit wary about words like that?
Yes, and I have to avoid the words because I think people often, maybe that's why I never use the word healing, because I think people often kind of confuse or associate healing with curing. Which is why I think as a doctor I probably didn't use that word, because I was trying to be really clear in what I was trying to tell people, especially when things weren't so good, and not give people false information or lead them somewhere that was incorrect. And I think within the kind of Christian context, people often still think of healing as curing, so that if people people say, well, I'm not going to come to a healing service, so I don't need to be cured of anything. Whereas actually healing is so much more.
Okay, well let's deal with that then. So if you're using healing in a Christian context, if you're advertising healing service, so what do you say healing is, Kathryn?
So I would say healing is about it, and it may be about curing. I think God works in very strange and mysterious ways, and sometimes miracles do happen. And I'm saying that as a doctor, and I think I'm probably quite cynical when it comes to, but I do know of people who have had things I certainly can't explain medically and who've received prayer. But most of the time I'm thinking of healing in terms of healing my relationship with God, of healing my relationships with other people, of healing relationships between nations. So healing in a much broader, getting into a right place with people, and that's sometimes the right place with me and God, and healing of past hurts. So I think, deep within lots of us, there are things that have happened. We've all got kind of deep scars, and they may not necessarily be physical scars. It might be, but often they're psychological hurts that we've received from other people, and those are the kind of things that, and it's not, it's not a quick fix. I think, it's not necessarily a quick, it's all going to be fine. It can be part of a much longer, slower process. God doesn't work necessarily like that.
Yeah. So, and I would sign up to that. We could say that's maybe emotional and spiritual healing, or healing of relationships. So the inner cynic in me, and you'll have to forgive this question, the inner cynic in me says, well, I'm backing off. Alasdair, I'm backing off from the whole physical healing thing because I'm just too not sure about that. And so I'm elevating these other types of healing just to compensate. So do you feel like that, or is that really unfair?
No, I think that's absolutely reasonable. And I think as doctors, I think that's, we come with a kind of a slightly inbuilt cynicism as part of our training. We have, that is part of who we are and where we've come from. So I think we just tend to be very wary because we see claims made in all sorts of different quarters about healing, not just in the Christian context, but in all sorts of things. Tomato juice and all sorts of things that they're going to heal, they're going to cure you. So I think we do come with a certain element of just wariness. But that's not to say sometimes I think things do happen or can happen, but we don't very often see them at the in the current times.
And what about the distinctiveness, if there is one, of Christian healing? So do you think there is something special about the idea of healing within the Christian ministry as opposed to secular healing or healing in any other context?
Well, I guess that kind of is completely underlines everything I do as a Christian minister, in that as a doctor, I could use drugs, I could use radiotherapy, I can talk to people, and certainly, talking to our patients is a really important part of what we did, what you do as a doctor. But as a Christian minister, I think it's much more holistic. So I can pray for people and look after people in a slightly more holistic. It's more than just the physical. It's the emotional. It's the relationships. It's all the other things which I think probably make the adult. Not just the healing the whatever medical condition it happens to be.
You see, I feel very differently about it, and that's probably because I have a weaker faith in that. I quite like the security of handing out drugs and treatments because I kind of believe in them.
And I don't disagree with that at all. I very much like there's a passage in the Apocrypha from Sirach, which was really, really helpful to me when I was kind of struggling with, well, where is God in helping me as a doctor? And you know, the gifts of pharmacy and healing and knowledge are God-given gifts. So
it's a good passage to bring out on St. Luke's Day. That's when it tends to appear, the Sirach reading. No, I certainly take refuge in that Christian healing must include all the hard work that goes on in
absolutely, yes,
it's not orthodox medical.
It's not completely separate. And absolutely, and everything that's happening currently in our hospitals, you know, sadly, so many people having to, you know, go to extraordinary ends to look after thousands and thousands of people and look after them and be with them as they die. You know, that is, you know, that's they're being God's hand and feet, even if they don't perhaps even realize that they are. You know, that is a real healing ministry, sitting and holding somebody's hand, even if they don't perhaps see it in that way.
I mean, so yes, and I think the other thing that COVID has told us about the healing that goes on in hospitals is actually people having their relatives and friends come and visit turns out to be a really huge thing. So I guess that when you were on the ward, you might have thought patients and relatives coming was kind of nice, and maybe sometimes irritating because they get in the way. But now we do realise, so practicing medicine in the hospital without visitors adds a huge strain to people.
Yeah,
they feel they have to compensate.
Yeah, I took a picture quite recently down in what is now a converted hospital in Exeter, and it says patients friends are able to visit a patient on Tuesday, Thursday, and Saturday afternoons between 2 and 4, or something along those lines. You know, it's only a couple of times a week for really short periods. So we kind of, I think we've realised over the years that having people coming is really, really important, isn't it?
And I guess what I find helpful about that observation is it shows us the importance of people being in their family and in their community, receiving ordinary gestures of love of people visiting and talking. So in the context of a sort of formal ministry, so Christian healing services or having times of healing ministry within regular services, is that something you're warming to, Kathryn, now? Is that something you want to take with you to another post, for instance? Or do you want to have a more sort of fuzzy approach?
I'm not sure about the fuzzy approach.
Yeah.
Having been involved in healing services, I think they're really helpful for people. And also having them slightly in the mainstream and main services, I think actually is really helpful. Where I'm now as a curate and where you were as a curate, having a regular healing services means it's kind of normal. And lots of people do go up, you know, lots and lots of people who are there on that day will go up, including the children. They'll come up for a blessing. They understand that it's, you know, there's something special that's happening, and they are open to receive whatever it is that they need to receive. So I think in some ways it's really, really helpful, kind of making it a normal part of ministry, not making it something that happens sort of off in a side chapel a couple of times a week. I think
or once a quarter in a afternoon service that 3 or 4 people attend, which is another model.
So I think what I would take wherever I go next is that I think it's a really helpful thing, and I think knowing how much people are hurting at the moment, and I'm just having so many conversations with people who are Anxious, in pain. There's just so many hurts. Some of the hurts are just, it's almost too many to even kind of be able to kind of process it. I think that kind of ministry is going to be really, really important going forward. But also having a healing ministry where we go and see patients, parishioners in their homes, and offer prayer for healing, offer anointing for healing in that situation as well, is also extremely powerful and can be really helpful for people. So I think offering the two, is helpful.
Do you miss anything about medicine, in the sense, is there something that the church needs to learn from medical practice in terms of dealing with people and offering hope? Or
I mean, I certainly miss all my colleagues. We were, they were great teams. There were lots of them really amazing people who were just wonderful. I just remember, the nurses when I was a junior doctor, who I would appear at on the ward at some ridiculous time in the middle of the night, and they'd sit me down with a cup of tea, and were just so kind. And those are the people that we work with, and who I do miss. I kind of don't miss the more management or the management side, and I certainly don't miss the time pressures. And that's one of the real privileges of ministry, is that I can spend an hour with somebody, and I I can come back the next week and say, well, I'll come back. Whereas, after 15 minutes with a patient, I knew that I was, I'll be looking, I would try not to look at my watch, but I was aware, usually by the clinic nurses, kind of looking slightly kind of wary, that I was half an hour behind or an hour behind, and I didn't have that luxury of time. So I think, the time is something that I have that I didn't ever have before.
And is there anything now about your life as a minister that you'd want to take back into medicine and tell people like me, this is what I've learned, we need to be doing this?
I don't think I'd ever want to tell you anything, Alasdair.
No. We're all learning.
I mean, I think oncology was quite good in being quite holistic, in that just because of the kind of the nature of the beast that we were dealing with, we tended to have holistic assessments. So we were quite good. We weren't far from perfect, but we're much better than in maybe other areas at looking at people's kind of psychological needs as well as the physical needs, and actually referring them to kind of to get financial grants, and we knew where to post people for all of those things. So I think in oncology we were quite holistic, and we did look after people's spiritual needs. We did ask, that's was one of the things that we used to regularly ask people about, although obviously not in a kind of quite Christian context, and I still couldn't pray for people, and that was really different. But I think that the holistic nature of things that in oncology did work, that I know that not all specialties are able to do in the same way. Oncology gets got lots of money because it has Macmillan grants and things like that. So not every specialty has that same amount of resources at their disposal, and that holistic looking after people, I think, is and being able to pray for people is wonderful. And as a minister, people will expect you to pray for people, and you never even people who don't go to church, you say, can I pray for you? They go, oh yeah, of course, we'd love you to. And that's what I really miss, that was always a real tension for me, that I couldn't do that. And I did pray for people, they just didn't know I did.
So it sounds like you've made the right move then, Kathryn.
For me, yes. That's not to say that in the last year I haven't had severe angst, because I have. I did volunteer to come back, and I did my DBS form and all sorts of other forms that, you know, but I didn't get called up, and I still haven't been called up. And if I did, of course I would come and help, although I'm a bit rusty, but I think I could probably still do some things. So yeah, that's kind of, you know, it's kind of been that kind of yeah, a question again about, am I doing what I'm supposed to be doing? So I've put myself out there and it hasn't happened. So it makes me feel that perhaps I am where I am supposed to be.
Well, it's good to go through these re-evaluation moments. Keeps you nimble.
Something like that.
Kathryn, thank you very much. That was really illuminating. Thank you.
You're very welcome.